I'm Karen McLean. I'm a gynecologic oncologist at Roswell Park Comprehensive Cancer Center. When a patient comes to us with possible diagnosis of ovarian cancer, the first question is whether we know that diagnosis or whether we just see someone who has an ovarian mass. And those two situations really influence how someone is managed. If we don't know their diagnosis, then surgery comes first, and as I tell patients in that situation, almost always they get chemotherapy after. We're thrilled if they're in the category that doesn't require chemotherapy, but most patients with ovarian cancer require chemotherapy. In the patients who we know have disease spread, then it depends on a number of factors, including how much cancer they have and their other health issues, whether they start with surgery or whether they start with chemotherapy first, but they will receive both treatment modalities ultimately. In some settings, minimally invasive surgery is quite appropriate in patients who have very little disease or who don't have the diagnosis yet. Additionally, in patients who start with chemotherapy and then have surgery after, they may have very little cancer left because the chemotherapy has shrunk it. And there are actually now national studies looking at whether or not we can do minimally invasive surgery in that situation. There are a number of specific reasons someone should come to Roswell Park for ovarian cancer care. I think the first starts at the very beginning with pathologic diagnosis. We have an excellent gynecologic pathology team, and we always want to take the time and focus to make sure we're really getting the right diagnosis before someone gets treatment. And then the second major reason is that integration of care with the gynecologic oncologists, the pathologists, the radiologists, and then perhaps most important is the clinical trial opportunities here. And I think Roswell Park is really leading the field in clinical trials, particularly immunotherapy-based trials, as well as trials that are early in a patient's treatment course. For example, we now have a trial that's open for women who are starting with chemotherapy, and that's a space where they're not going to get many trials at other institutions. When younger women are thinking about cancer care and their fertility, it is very important that they see specialized experts that really focus on oncofertility so that all of the options are considered before they undergo their cancer care, before they have their surgery or before they start chemotherapy. And Roswell Park has a dedicated treatment group that's specifically for young adults and oncofertility, and that's a real strength here.